Good morning, and welcome to our continuing series of presentations as part of our Aging at Altitude program. My name is Al Manzi. I'm the president and CEO for Prairie Mountain Media and publisher for the Times Call and the Daily Camera. Today's session is entitled Non-Surgical Treatments for Erectile Dysfunction. Our presenter today will be Kolleen Hulyk. She's managing partner at Superior Medical Solutions. Now remember, following today's presentation, I'll moderate a Q&A session. So please feel free anytime during this presentation to enter your questions either in the Q&A or chat function on your device. Please welcome Kolleen Hulyk.
So, my name's Kolleen, and I'm with Superior Medical Solutions. We're in Arvada. We've been here 20 years. We're going to talk today, and I want to grab your attention. I know this is an expo that's virtual, and I've done many in-person ones before, so this is very unique. But anyway, my way of grabbing your attention is to tell you that we are going to talk about your sexual health. And also, I might tell you a few secrets about the ED business in general. There are other clinics out there that do similar to what we do, but we are very unique in our approach. So we're going to talk about erectile dysfunction, and we're sort of a family business almost because we all are so close and have been there for so long. Personally, I've been there for over 10 years doing this, and mainly I answer the phones really and help people order their medicine and assure men that we're there to assist them and determine their perfect treatment for them. We have several people in our office that can do the same thing. And also, of course, we have a doctor and other doctors too that can help guide you as well. So you might, if you call our office, talk to Ken or Don or Wendy or myself. So first I wanted to kind of just talk about sexual health in general, because we are there for the medical part, but there is a huge piece that everyone keeps in mind with their health, and especially when you're growing older, there always are changes, as we know, in our bodies. So sexual health, as we know, it's a serious topic, and oh, I did lose something here. In a minute we'll do that. So like I'm saying, it's a serious topic, and it couldn't be more important. And in healthy, intimate relationships, and this is the part I kind of wanted to highlight, both partners are aware of their own emotional vulnerability and just the physical part that you're wanting to, keep in mind. And we all want to find joy in physical and sensual relationships, but also find joy in just general life, and through enjoying anything as simple as the saying of dancing in the rain, and just having that holistic look at yourself and your body and your mind in a healthy way. And we know there are many ways to have sex and be intimate. They're sort of intertwined topics for sure. And, intimacy can be alone or with a partner or whatever that looks like for you. Focusing on trusting yourself, and this is sort of a personal thing as well, and just learning to recognize what my truth is with this whole topic. And it's your personal journey, and it's not part of our business of what that is, but we are and do really want to be open with you and discuss everything with you that you want to. But particularly just the medical part, we can really do a lot for you. We help people over the 20 years. We've been helping thousands of men. They come in, they're very happy with what we do. And I'll tell you more about that. So when you go into our website, actually, hopefully the screen is showing you the first slide I have, which is our website. And so am I going to be able to see that? Yes, please. And so that's what you'll see when you open it up. It's smscolorado.com. And you can reach out to us by, let's see, by phone or by email, any way that works for you. And then let's see, I am got a little bit mixed up, but when you see the website, it just says if you're looking for superior satisfaction in your love life, Superior Medical Solutions, we can help you with it. And so let's go to the next slide, if I can see how to do that. This is what the technical part, oh, it's hiding under the bar. So this is our doctor. His name is Aubrey Copeland. He's one of our doctors anyway. And he's just a great guy. He's very personable. He's been with us 10 years. He knows what he's talking about and can really guide you and help you know exactly what kind of treatment you might be interested in with us. We're here to educate you and to guide you, and that's the bottom line. We want to answer your questions, and you can call anytime. We have a combined experience in our office of over 50 years. So there's a lot of knowledge when you ring that phone and talk to us. You will get good answers. And I also want to kind of start with the fact that I am not a doctor, so any kind of really technical medical questions will need to go through Dr. Copeland. But I think what you'll learn from me is going to be pretty specific and help you a lot. So we were the first company like this in Colorado to provide what is called trimix medicine. So that is what it is. So there's other names. There's they might call it a bimix or whatever they do call it. So we have succeeded with this medication where others have not quite made the mark. We are straightforward in our approach, and we just don't mess around. We do what we do, and we do it really well. And we want to be able to help as many people as we can and get our name out there a little bit more. Let's see. So I think what I'm saying also is that our business approach is a little bit different and unique because we specifically target the ED issue, which is most often a blood flow issue. And so that's what these medicines do, is they directly address the issue of blood flow and work immediately, have rare side effects, and I'll tell you more about that as well as I go. Let's see. So I wanted to make sure I tell you that I'm not the doctor and I don't want to overstep his role here. So let's see. When you come to our office, it's in Arvada, as I said. You'll come in through double glass doors into a very nice brick building, and we're the first office on your left-hand side. You'll come right in. You'll tell us your name, and we'll get you into a private patient room right away to fill out basic really medical history. And then Dr. Copeland comes in immediately and meets with you. Takes about an hour. It's really, like I say, straightforward, because what I want you to hear from me today is that although a blood flow issue can be specific to an underlying issue, and for that and many other reasons, you need to go to your regular doctor or a specialist in that area. Trimix medication is what I call innocuous, and that simply means that it doesn't affect any other parts of your system. And so, with say the oral medications like Viagra and Cialis, which we can prescribe, there are often some side effects that men don't like so much. And those side effects include heart racing, um, sweating, headache, and different things. And then on top of it, I know from what I know and people I've talked to that sometimes it just doesn't work. And so it might work in the beginning when you start using it. It sort of loses its punch, and then this comes in and works every time. And I say every time, but I mean 98%. And so with it working so well and no timing issues, you use it right when you need it, and it leaves your body almost immediately. So it's really good that way as well. And it's, like I say, been used for decades now. And the secret, I'll tell you a little bit right now, is about that, because it's kind of coming out from the shadows. People are learning more about it. And the main drug is called prostaglandin, which is something technical. If you wanted to learn more about, you can. But just in general, it being um, a little bit of a secret out there. And we want to get our name out, and we want to get the word out about Trimix because it works. And people are a little bit hesitant about it because of the application, which we can talk about more later as well. And then let's see, let me go to my next slide. And this is, I wanted to put this on for you just as an example of one of our commercials that we run digitally. And in terms of digital marketing, we have never done it before in the 20 years. Really, all we've had is the website, and now that's updated. You can book online. It's super simple to look at. And, so this is, I'm going to play for you, pretty cool commercial that Ken made. And here we go. So that last part of the commercial tells about success on your first visit, or it's free, and that is true. Um, Many clinics around town do what we do, and they do promise results as well. But I think we've had a special way to focus on getting that really perfect formula for people, so that then you have success throughout. So the other part of just that message in the commercial is about walking through our door. And that's really your first thing. You need to get up, go to your car, get in it, come to Arvada, walk through those double doors, and then we will take care of the rest. We'll make you feel as comfortable as we can. We're always, I really want to stress, we're a phone call away. Um, I'm happy to tell you more, and hopefully I'll tell you a lot right now so you'll know exactly what to expect. And that's part of the secret part again is, and I haven't quite told you the entire secret, but it's amazing. And I believe in what we do, and I think you'll be really, really impressed. We had someone come in today to pick up medication, and he said, "Oh my gosh, since I started this, it has changed my life. It's made my relationship. I'm engaged to this new gal now." And he said verbatim, "I could not have done this without you." And so that really warms my heart and really makes me feel good about what we do. And again, we believe in it totally. So, yep, get up and come on down. Hopefully the process we present to you when you come will be smooth and seamless. So we look forward to seeing many people, many new people. I'll go to my next slide. So what do we offer? So we treat ED with the medication that works immediately, as I've been telling you. We do use, which is prostaglandin mainly. And again, it's highly effective and can be tailored to your needs. Okay, so whatever your desire is and what your goals are, we'll talk about them and talk about what a healthy dose would be for you, and determine that until we get it just right for you. And you do change, of course, over the years. So we have people that have been with us for 10, 20 years. So occasionally it does get switched up or changed. They take breaks if they're having a break in a relationship or for whatever reasons. We really try to make it easy and convenient for you. And I did say it's called Trimix, and I want to use the word infinite, but that's not really totally accurate, but it kind of highlights how many ways this can be mixed, and that our doctors are, I'm telling you, the best. They know how to do it. They work with you. And it is, to me, very surprising every time when different people come in and that their dosages are so vastly different. I think that tells me that it does take a special doctor to know how to do that, and we have that. So the Trimix and three main medicines, what they do is they're vasodilators. They open up the blood vessels. So as I said, that lack of blood flow is really usually the main cause of ED. And so this is really the most popular treatment if you know about it. And there are, I promise you, probably close friends of yours that may use it. You know, it's not a topic that you will bring up with, you know, an acquaintance, even maybe not even your best friend. So we want to teach you about it. It can be used, as I said, because it doesn't affect other systems in your body. If you have diabetes, prostate issues, heart disease, just about any condition, we can treat it because it won't affect your blood pressure. Or actually, some of the medicines like Viagra and Cialis started out as medications for high blood pressure. And then they found out, well, it lowers my blood pressure, but guess what else it does? And that's really how it started way back in the day for those types of medicines. So the oral type. And so it's really a tried and true product, and it works often. It's very successful. Take a quick drink. This is so different than being in person, and it's hard to understand who might be looking at me and listening to me and being able to picture your faces. And I hope there's lots of you out there listening. Let's go to the next slide here. Or I kind of talked without going through this, but relaxed environment, a lot of other clinics out there. It's a little bit more like a mill. And so you're going through from this person to this person to that person. And it's just, we're just super relaxed and simple. We do our very best and pride ourselves on patient service, from the individual waiting room that you come right to our licensed physicians. And that is a point to be made again as well. We have only licensed physicians. Other clinics, we could use physician assistants, but we choose not to. We want to have the best for you and the best chance and the safest route for you. Let's see, effective, we've talked about that. And in terms of its effectiveness, we fully guarantee that our treatments are effective. And in fact, if you do not see results on the first visit with the test dose, there's no charge to that. So if you choose to do that test dose, you're gonna be golden. And then the physicians, I can't quite see all that, but I think you get that point there. Let's go to the next slide. So I really want to help you make this be comfortable and lighthearted. So there's my corny joke. You'd be cranky too if you had a erectile dysfunction. Oh, I know I can hear so many of you laughing. I appreciate that. Here we go. Here we go. So what we treat, let's see. Well, again, we treat ED. That's it. That's all we do. We don't go into testosterone. We don't go into any of your other medical, things that you need to keep up on. You need to vigilantly keep up on all of your men's health issues by seeing a regular doctor, or if he, sends you off to a specialist, that you do that as well. Continuing those men's health visits and testing, of course. The medications that I'm talking about, they are strong, and they've been used forever with little side effects. And I'll tell you a little bit later about what that 1 to 5% side effect can be. And you might have heard about Trimix, but here's our thing. We want to tell you, we want to be honest. We want you to come into our office and know what to expect, and feel like we've been honest with you and straightforward. So whether that technique works for us or not, I believe it will. I think, men have been underestimated in this area. You are smart and have choices, and hopefully you'll make the choice to come to us, and we will teach you. We'll continue to educate you and stick with you throughout. And the other clinics do, they pretty much mask what this is. I mean, it's kind of exciting to me, because I do see other advertisements out there where they actually say they do this or that with some of the other therapies, and then they'll say at the end, and if you come in now, you'll get a free gift. Well, guess what? The free gift is typically going to be this medicine that they're afraid to tell you about until you get there. And we don't want to do that. We want to tell you upfront and be honest. And so we're going to have a free gift for you, but I'll tell you what it is. It's probably going to be some free medicine. We try to keep our prices fair, and we try to run specials. We try to do things like that do in fact give you some benefit, that kind of thing. So let's go to our next slide. Who do we treat? That's a big question, because we are in the middle of an aging expo here, but we treat men from 20 to 92. Even if aging does sort of bring about more of a need, typically we treat men of all backgrounds, all issues, and we certainly pride ourselves on that. And so just about any man of any age can experience ED. And then there is also PE that you might have heard of, and that's premature ejaculation. So even if you can get that erection and you can do it successfully, it might be really a short amount of time, and you'd like it to be a little bit longer. We can help you with that, and we can kind of play around that until we get it exactly right for you. Yeah, it's going to be from anywhere from, you might have a profound issue with it that we can help you with, or maybe you just need what I call a booster, and it simply will enhance your sexual experience. We do want to get that formula for you. The doctor wants to do it in a safe way, so there is certainly, some limitations on what we can do, but in terms of being safe and healthy with it. And we've had many people in their 80s, many, but we have had, a 92-year-old man that came in, and he was perfectly happy with it. And the population of this demographic of aging people is just bursting out. All of the 55 plus, all of the different communities that are popping up for this. There's a good reason for it. We're growing in number, and we want to be active. And I say we because I'm right there with you. And we want to have fun. We want to play and still have a sexual relationship. And it doesn't have to include sexual intercourse, but the intimacy part, and maybe that is what you want, then we can do that for you. And I think most people think, unless you know the secret, most people think that it's over and they're not going to get to do that ever again. And to be able to it's huge. It's a big deal. So let's see. We treat anyone who comes our way, just about. And so in light of keeping it light, again, it is a growing problem, as we say. There are so many puns for it and different, expressions we can say, but it is serious and it is a growing problem, and we want to help you. So we will do our best. Let me go to the next slide. So let's go back and talk about the definition, the exact definition of erectile dysfunction. And it is, simply put, the inability to achieve and sustain an erection suitable for sexual intercourse specifically. And it can happen to any man, as I said, and it can be due to, issues like stress, depression, and of course, it can cause stress. So you really have a double-edged sword there. And this can bring on such relief because it's going to work. And it doesn't take the mind-body connection for it to work. So you'll get to it working, and then you can get the mind-body connection as you go. So, and there's just some statistics there for you about the growing need for it. Okay, so it is delivered directly to the penis and is innocuous, meaning it does not affect any other systems in your body. And it's a simple procedure that we will teach you how to do. It's very simple, and you'll get an erection immediately, which is really what we want to see. And it's like I say, time to give people much more credit to be in charge of what they know about it and what they know about their body and what they want. So we tell you right out that it is, as I've said, simple and straightforward. We'll go straight to the source and leave that source pretty much immediately. Okay, so let's back up though before I change to the next slide to this bubble here, FDA approved. That's a big deal. It is FDA approved and has been for a long time. So some of the other procedures out there are touted as FDA recognized. So that's a little education for you too, and a little nuance that you may not have ever noticed, but there's a big difference between approved and recognized. Very effective. And we are a true and trusted local business. We have many, many followers. And then what we do, I'm going to go through what we do just straight from my screen here. The first one talks about pricing. And in terms of pricing, you know, we typically run a special for the office visit, which is very minimal, and you get the opportunity to come in, meet us, and be educated and such. So we try to provide as many affordable options as we can that'll work for you. In terms of contracts, that next point, we don't do monthly contracts. Some do. And so that means you'll be locked into, say, a 2-year program where you may be getting your medicine, but you know, it's near impossible to get out of it. And they're withdrawing money from your bank monthly. We do not do that. Our pricing is based on one price when you come, and then the medicines you purchase are yours forever, basically. So if you don't use all of them in a fast manner, like 6 months, you can use them over a year. And, you know, some people get up to 80 medications, and that's fine. But you can get as little as 20 as well. The procedure, as I said, is FDA approved and has that high success rate. We have all of our own doctors that are licensed medical doctors and are highly trained in this specifically. And our office environment, we like to think, is very professional. We're COVID-19 compliant for sure, and we try to be as discreet as possible. And when you come in, you'll be taken to that private office, as I said, and seen by typically Dr. Copeland pretty much immediately. And he is just a special person. He's actually a friend. And as I said, we are kind of a family here. Even if we're not related, we love each other, care about each other, and mostly we care about our patients. And we want to give you that best service that we can. The testing, so this is tricky because, you know, if you hear from somebody that we're going to do so much testing, we're going to do everything for you, if it doesn't have anything to do with what we're trying to achieve, then we just don't see the need for it. And we really want to not do any of the unnecessary testing that's about this. And I can't stress more that the other stuff needs to be addressed, but we are confident in 20 years that with such little side effects that it's pretty simple. And the experience, you know, at Superior Medical Solutions, we are the longest running ED clinic and have that 50 years plus combined experience in our field. And that's just the bottom line. There are other ED clinics that have come, they've gone, and that happens all the time. So there's a whole new set of people, you know, out there telling you things that you don't want to know or need to know for this. Let's see. I have done well with my time, I'm told, which is, you know, I was worried about being able to talk long enough, but they say I have a gift, and I think they might be right. I love to talk, and I love to talk about ED, and because I don't think about it in terms of the sexual part, I just get really excited that it works so well, and it's so easy to do, and it works. I keep saying that, but that is the bottom line. If you go somewhere and you spend oodles of money and it doesn't work, but they had a really cool office, or they had TVs on when I got there, or I got to see, you know, 4 or 5 different people, then I don't think that means as much. So what we never do, I think that's super important. And I kind of did say it about the pricing for sure. You know, it's like when you join the gym and you're hooked into the gym and you can't get out of the gym. I want to quit the gym and you can't. So that's what kind of happens, I think in other clinics somewhere around town. And the contracts are, you know, they feel very much like a commitment that you don't want to have to do. And then the procedures, they are simple to do. The doctor will do the test dose in the office, and then you'll be ready to go. You'll get 3 samples from that to take home if you decide to do it. And they are based on that test dose. And I'll tell you a little, I'm sure I'm gonna have questions about that as well. And so here we go. Side effects. There we go. I think I said everything in that. Is it normal? I think that's the first question that should be put out there. It's totally normal. It's a normal part of aging, but it doesn't have to be untreated. You know, with the magic of medicine, we are all set. So here we go. Let's see. And we talked about how effective it is. And I think I've said that a few times. And I've talked about what to expect when you come to the door. You're going to get into that room. You're going to see the doctor. You're going to write down some of your medical history, and you'll be good to go. And nope, you don't need to sign a contract with us. The potential side effects, you want to know about those. And really, the side effects with the oral medications, which we can prescribe, definitely. We can write you a prescription. We have it available in the office. But for some men, it doesn't work or causes side effects. So a lot of times we do you know, prescribe that for you. And certainly if that's what you want, we'll do that. But the only side effect with our medicine for sure is what's called a priapism. And I will explain priapism a little bit more. I'm sure I'm going to get questions about that. And I'll go to my last slide. How soon can I expect results? Immediately. Before you leave our office, you're going to have had a successful experience. The test dose that we do here, it is not intended to cause a full erection because we don't want to send you out into the world with that, but it does tell us how to develop your A, B, C samples. And those you get to go home with. You get a little bag and you get your ice pack and your samples, and you can go home and try the first one right away. And it is success on your first visit that way, or it's free. So that's it for my presentation in terms of the slides that I have. So I guess we're going to go to questions.
Well, thank you, Colleen. Very interesting. Let's talk a little bit about the actual procedure, because I think I'm still confused as to what the procedure is. So
Right.
this is not a pill, obviously. This is an injection.
We do have pills available.
But are the pills the same as the injection?
No, the pills are just what we know, which are Viagra and Cialis.
Mm-hmm.
And they can be just fine for a lot of people. But yeah, we focus on the injectables. And it's kind of like doing a presentation in college where there's so many pieces to the puzzle. So let's clear that up. So it is an injection into the penis. It is painless. And I'm quite sure none of the men out there want to hear me say that, but I have been around it for a long time, and it really is. It just goes under the skin. You use what's called an autoject, so you never see it. It is a spring-loaded device that just goes together with the dosage in it, and then is simply placed on the skin, and you hit a button and it gets delivered directly into the penis, works right away, and that's it.
So let's talk about that. So once you go through your process and you're in the office, you meet with a doctor, and it works for you. Does that injection equipment go home with you, or so you can use it when you need it?
Yes, thank you for that question. You do. We will give you your bag. It's a nifty little bag that says Superior Medical on it. It's a thermal bag. You'll get an ice pack because you do want to medicate the medication, the doses, and then you'll get the 3 samples. And this is the part that isn't clear, and I'm going to try to clear that up. You go home, you do A, B, C, and you report to us. So if A, you go home and try the first day and it works beautifully, then you're good to go. You'll call us, you'll say A was perfect, let's get going. And if you bought 20 medications, like I say, that's kind of the least amount. We give them out to you as needed. That's the key, because as needed means it has a 3 to 6 month lifespan. And so if you want to get 2 of them at a time, we'll give you 2 at a time. It's very convenient. We can get them to you very easily.
So when you say ABC, you're talking about basically 3 different cocktails of drugs that may be more effective or less effective with you personally.
Thank you for that word. Yes, and I say mixed, but yes, it's these different drugs that are mixed in different ways for different people. And they do a little bit different thing, each of them, but mainly they're vasodilators, like I said. And, one man might take a very tiny amount, and then the next one takes a full syringe dose of it.
So let me ask you a question. Does, because I'm sure this would come up, is like with Viagra and Cialis, particularly Cialis, can have a longer effect, meaning that you take the pill and then you can have you can achieve erection even when not taking the pill for a period of time after you've taken the pill. Is that similar to your medication?
Right. So an extended time, which may have its benefits, but I think ours has its benefits as no, but you can achieve the erection, have your ejaculation and still remain firm. So it just depends on how much you want that, or how much is safe for that. So it's a lot more adjustable than the oral medication.
Is there any danger in multiple use in a single day?
There is, yes. So I was definitely going to say that for sure. In the single day, when you come to us and take your samples home, you can use your sample A, but after that, you want to give it 24 hours between doses at least. And a lot of them will say 3 times a week, or, whatever the doctor says, but no, you cannot use it more than once in a day. But depending on your dose, it can be a longer duration if you want it to be.
Do you prescribe any natural supplements along with your cocktail of injectables?
We do not. And the reason we don't is that we have found in our research and from what we've heard from men is that they really aren't effective. And there haven't been any out there that we can see that really work as well. It's just, that would be, we do want to say that, a healthy lifestyle is for sure going to help you achieve an erection in general, but I don't think a specific herb is going to do it, or a supplement.
So let's talk about the expense of it, and let's talk about, is it covered by insurance, and can HSA funds be used for it? So can you give us some idea you had mentioned that 20 dose minimum. What would a 20 dose minimum cost for a man going in to see you about this issue?
Yes, very, very important. So for our listeners today, I put together a package that we've never done. And I like to call it the Silver Slicker. And for that, I'm going to do 10 meds. And so that with the office visit of typically $95 is $5.95. And we've never done that before. But if you are a typical person that comes in, the package that's called the Gold package is most popular, and it's around $1,000. Okay.
And
So
that's for how many injections?
so that would be for 25 injections.
25.
Yes, yes, which is when you compare the prices around town, ours are really, really hit the mark. So it's not,
Excellent.
yeah, it's not inexpensive, but it is something that is really important, and lots of people do it.
And a couple of questions about insurance. Is there any insurance that covers?
Yeah, you know, the regular insurance does not, but if you have something like an HSA, that can possibly help cover it, but no, it's not under Medicaid or
And it's not, yeah, it's not under Medicare
right. It's not.
or any of the major health insurance programs.
No,
So men can typically be significantly more shy than women. What do you suggest in terms of communication for somebody who might be thinking about it, but and is experiencing the problem, but may not necessarily have the guts to go in and talk to a doctor and go through what they have to go through?
yes. Well, ultimately, you have to come to the office and see our doctor. Our doctors are all men. And then we have several men in the office that you can talk to, just like I'm talking to you. But I do experience lots of success with many men on the phone where I can gain their trust very quickly because they know I'm just educating them. And I know it's hard, but it can be done. And we do have men that can help them as well.
Excellent. And this is just a men's clinic. There's no women options for any of this.
Correct.
Okay. So if you were to say, what are your ideal targets for treatment? It's really anybody that has erectile dysfunction, because health issues like diabetes, blood pressure, and heart issues, you had mentioned in your presentation, are not disqualifiers for using this product.
No, and in fact, those types of issues are what we treat best because it doesn't affect any of that and it still works.
And you talk to a lot of men about this. What's the level of pain that men experience with their first time injections?
Typically 0. Okay, so you're gonna feel a tap and I'm not a man, but yeah, it's not painful, it's painless, period.
Excellent. So let's see if we have any additional questions from our audience.
Okay.
And once again, why don't you tell us your special that you're running, and also just give your address again, where you're at, and maybe your phone number in case somebody wants to write it down, or your website and wants to write it down.
Perfect. So that's smscolorado.com. You can book online. You can get more information. You can get our phone number, 303-424-8988. And then this special that I have, I'm calling the Silver Slicker. I could get in trouble for, but we want to offer it to anybody who's listening right now to be able to give it a shot. Okay. So that one was $5.95. It's $95 for the office visit, which is less than what we pay our doctor. But we want to get you in there so you can try it. And then if you want to go for the Gold, which I suggest highly, is that 25 medicines for your office visit, and the medicine is about $1,000. But you can go anywhere from, we do have a smaller package of 20, which is called the Silver. Then we have the Gold, then we have a Platinum, and then we have a Diamond. And the Diamond would give you 80 medications. And we have many, many men that do that. And that's like almost 3 times the price of gold. But if you can do it, it's a great choice.
Yeah, and I think what separates your treatment from others is that it sounds to me like it's pretty much a guarantee that it's going to work. And so that is, to me, is a big separation of your product versus some of the oral medications.
Right. And there are other devices and procedures out there that have varying degrees of success, I think. And that's going to cost you anywhere from $3,000 to $6,000, and you'll go in 6 different times, at least maybe 12, and have a procedure done that many times. And it's just a little bit invasive, I think, personally. Not
Right. So guaranteed to work, painless. You can select the packages that work best for you, and doesn't impact or isn't impacted by other health related issues. It sounds like this might indeed be a solution for a lot of men who don't want to necessarily take the chance of taking Cialis or Viagra, while they're both high blood pressure, heart medication type medications. Can also be impacted by other prescription medications or by health-related issues, according to everything I've read.
Yeah, so, and especially for aging people. So
excellent. I think we're out of questions. Kolleen, I want to thank you so much for being so open and giving a fun presentation and an interesting presentation, and providing our audience with a really good understanding of what SMS does and how you do it. So thank you. I want to thank everyone for joining us today, and remember to visit our website, agingataltitude.com, or through the Daily Camera or the Times Call, and support our partners. So thank you so much. Have a wonderful afternoon, and we'll talk to you again tomorrow at the same time. Thank you. Bye-bye, Kolleen.